Okay, so today we're going to talk about depression. Depression is a common mental disorder that includes depressed mood, loss of interest or pleasure, decreased energy, feeling of guilt, low self-worth, disturbed sleep or appetite, and poor concentration. Depression can come with symptoms of anxiety. These problems can become chronic or recurrent and lead to substantial problems in an individual's ability to take care of his or her everyday responsibilities. And depression can lead to suicide. Almost 1 million lives are gone yearly due to suicide, which is 3,000 deaths per day. For every,
That's
uh,
scary.
for every person completes a suicide, maybe 20 others will commit suicide. Because imagine your brother or sister commit suicide, what will happen to you? You may follow them and kill yourself with them.
1 million a year. Just imagine that. I want to know
Depression,
what's the percentage between like suicide and normal deaths. I'm going to search it up. Never mind. Ryan, continue.
uh, one of the causes is genetics. You're at higher risk of developing depression if you have a family history of depression or another mood disorder. And brain chemistry. There's a great risk for depression if the frontal lobe of your brain is less active. Scientists don't know if this happens before or after the onset of depression symptoms. Poor nutrition and drugs. Drug use or alcohol misuse can affect your risk. And finally is stress. Stressing yourself too much can lead to depression. Symptoms. We have sick ECATS, which refers to S for sleep problems, I for interest deficit, D for guilt, worthlessness or hopelessness and regret, E for energy deficit or fatigue, C for concentration deficit, A for appetite disorder, either increased or decreased, P for psychomotor retardation or agitation. Psychomotor retardation involves slowing down of thoughts and a reduction of physical movement in a person. It can cause a visible slowing of physical and emotional reactions, including speech and affect, and S for suicidality. To meet a diagnosis of major depression, a patient must have four of the symptoms plus depressed mood for at least 2 weeks. Dysthymia is a milder depression, but it lasts longer. If you have two of the symptoms plus depressed mood for at least 2 years, you have dysthymic disorder.
Okay. So for the last 2 days, we talked about anxieties and phobias. Um, we said that um, anxiety is a feeling. It's a normal day feeling that you have. I mean, it's a normal feeling. Actually, in some cases, anxiety is needed because it gives you that feeling of stress and maybe tough situation that you need to be stressed in. But what we talked about is when there's unnecessary anxiety that you have, which is anxiety disorder. The depression is kind of different. Depression is losing, let's say, losing that taste of happiness and purpose in your life, and it's kind of different because anxiety is a feeling um, that you have, and depression is more of a condition, or it's in the mind. Um, so how could someone manage depression, or how could depression be managed in general? Depression is a disorder that can be reliably diagnosed and treated in primary care. Um, Options consist of basic psychosocial support combined with antidepressant medication or psychotherapy, such as cognitive behavior therapy, interpersonal psychotherapy, or problem solving treatment. Um, I am not in favor of antidepressant medication because I feel like that's the cheap way out. Um, I feel like therapy and social support is the best way around. This is my personal opinion. It is a discussable topic. If anybody wants to intervene, it's okay. Self-help is an important approach to help people with depression. So yeah. Next slide. Reducing the burden of depression. There is a number of well-defined and evidence-based strategies that can effectively address or combat this burden. The key intervention are treatment of generic antidepressant drugs and brief psychotherapy. Again, I am not in favor of antidepressant drugs. Honestly, I don't know if they're halal or not, but no, I don't want to talk about that.
Of course, it's
Economic
halal.
I don't want to get into it. Economic analysis has indicated that treating depression in primary care is feasible, affordable, and cost-effective. When they're talking about psychotherapy and help, they're talking about when a specialist that knows about the condition and is an expert. He just talks to them, solves things out. They just talk to them until they get that sense back that they are missing. Any questions so far? Are we good? All right, so we're good. Okay, the common treatments are psychotherapy. This is when you talk to a specialist about your problems. Family or couple therapy. This is, let's say, a down, like you talk to your family about your condition and they help you back. Hospitalization. That's exactly what this means. Self-help strategies. I like this one a lot. It's when you meditate and do types of exercises that help help your mind and your mental health. Just thinking about things on a normal basis.
Like prayer.
Like prayer, exactly. Yes.
See what Islam does. Great religion, Mister. I recommend adopting Islam.
Allah يهداك Yusuf. Okay. And also medication. I do not support medication at all. I want to rephrase that. Any questions, guys?
No questions. Yes.
I guess we could go ahead.
I have a question.
Go ahead.
Are you depressed?
No.
Okay.
I know who's behind me. All right, go ahead.
Okay, so now we're gonna watch a video that describes depression in a good way. I think you can hear the voice.
I had a black dog. His name was Depression. Whenever the black dog made an appearance, I felt empty and life just seemed to slow down. He could surprise me with a visit for no reason or occasion. The black dog made me look and feel older than my years. When the rest of the world seemed to be enjoying life, I could only see it through the black dog. Activities that usually brought me pleasure suddenly ceased to. He liked to ruin my appetite. He chewed up my memory and my ability to concentrate. Doing anything or going anywhere with the black dog required superhuman strength. At social occasions, he'd sniff out what confidence I had and chase it away. My biggest fear was being found out. I worried that people would judge me. Because of the shame and stigma of the black dog, I was constantly worried that I'd be found out. So I invested vast amounts of energy into covering him up. Keeping up an emotional lie is exhausting. Black dog could make me think and say negative things. He could make me irritable and difficult to be around. He would take my love and bury my intimacy. He loved nothing more than to wake me up with highly repetitive and negative thinking. He also liked to remind me how exhausted I was going to be the next day. Having a black dog in your life isn't so much about feeling a bit down, sad or blue. At its worst, it's about being devoid of feeling altogether. As I got older, the black dog got bigger and he started hanging around all the time. I'd chase him off with whatever I thought might send him running. But more often than not, he'd come out on top. Going down became easier than getting up again. So I became rather good at self-medication, which never really helped. Eventually, I felt totally isolated from everything and everyone. The black dog had finally succeeded in hijacking my life. When you lose all joy in life, you can begin to question what the point of it is. Thankfully, this was the time that I sought professional help. This was my first step towards recovery and a major turning point in my life. I learned that it doesn't matter who you are, the black dog affects millions and millions of people. It is an equal opportunity mongrel. I also learned that there was no silver bullet or magic pill. Medication can help some, and others might need a different approach altogether. I also learned that being emotionally genuine and authentic to those who are close to you can be an absolute game changer. Most importantly, I learnt not to be afraid of the black dog, and I taught him a few new tricks of my own. The more tired and stressed you are, the louder he barks. So it's important to learn how to quiet your mind. It's been clinically proven that regular exercise can be as effective for treating mild to moderate depression as antidepressants. So go for a walk or a run and leave the mutt behind. Keep a mood journal. Getting your thoughts on paper can be cathartic and often insightful. Also keep track of the things that you have to be grateful for. The most important thing to remember is that no matter how bad it gets, if you take the right steps, talk to the right people, black dog days can and will pass. I wouldn't say that I'm grateful for the black dog, but he's been an incredible teacher. He forced me to reevaluate and simplify my life. I learnt that rather than running away from my problems, it's better to embrace them. The black dog may always be part of my life, but he'll never be the beast that he was. We have an understanding. I've learned through knowledge, patience, discipline and humour, the worst black dog can be made to heal. If you're in difficulty, never be afraid to ask for help. There is absolutely no shame in doing so. The only shame is missing out on life.
That's a great video, Rayyan. Good choice. Guys, any questions?
Not a question, but from a comment.
Go ahead.
The video made me emotional. I did not like it. Like, I liked it, but no, it made me emotional. No, thank you.
You have every right to do so. It is a sensitive topic. It is an emotional topic, let's say. So, it's not that fun of a topic, let's say. Okay. So to conclude all of this, depression is a mental disorder that is pervasive in the world and affects us all. Efficacious and cost-effective treatments are available and improve the health and lives of the millions of people around the world suffering from depression. Again, I would like to go back to the anecdote that I've shared in the beginning of class. Depression is like a person in the middle of the ocean that's drowning. A person who's depressed could take all the gas tanks and distractions that he can have, but at the end of the day, those distractions and that gas tank is going to run out eventually. So learning how to swim in this deep sea is vital for survival. And that's I would like to cap off the presentation with that.
And thanks for your attention. It's the end of the presentation.